Hello and welcome. I'm Julio Clavijo Alvarez, and a board-certified plastic surgeon in the United States. I would like to start by thanking you for considering us for your procedure. The purpose of this video is to learn about liposuction and fat transfer to the gluteal area, also known as Brazilian butt lift or BBL. Let's start by understanding what is liposuction. Liposuction is the removal of excess fat deposit from unwanted areas. Patients who are good candidates for the procedure usually have stored areas of fat that don't want to go away with exercise or dieting. They also have minimal excess skin with no folds. Now let's understand what is liposuction not meant to do. Usually patients that have excess skin and laxity of the abdominal muscles after losing a lot of weight or after pregnancy. Important medical history prior to surgery includes prior liposuctions to the area because of the increased bleeding, also hernias. Now let's understand what happens with cellulite and liposuction. Usually it gets worse because when you remove the fat, the support to the tissues is less and the dimpling becomes more noticeable. The stretch marks are the thinning or absence of the dermis. This usually gets worse after liposuction, as you can see here. The contours of the tissues are usually uneven. Now let's learn about Brazilian butt lift, also known as BBL. The first concept that we need to understand is the ideal shape of the gluteal area has the letter A shape, as shown here. The usual gluteal shape has the C shape, as shown here. Some of the surgical principles about Brazilian butt lift is that it's not just about injecting fat in the gluteal area. We start by shaping the surrounding areas and removing the fat. Once this is done, then we inject the fat in the gluteal areas to have a more pleasing shape. These are some important numbers to take in consideration when performing a Brazilian butt lift. The maximum amount of fat that we can remove in one procedure is 5 liters. Less if the procedure is bloody, because the most important thing is safety. The second one is that the fat survival in the areas that we want to inject the fat is around 50 to 70%, which means you're going to lose some volume after the procedure. Finally, in areas where there is hollowness, as indicated here, sometimes you might need to re-inject fat 2 or 3 times to obtain the heart shape that everybody wants. Now let's review some important considerations in preparation for your surgery. In preparation for your surgery, your health should be as good as it could be. Make it stable, especially if you have hypertension, diabetes, or anemia. When it comes to the labs, I will require that your hemoglobin should be greater than 12. Finally, ideally your weight should be stable or close to ideal. One of the most important topics in preparation for your surgery is to stop smoking. Please do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. Also, please stop any blood thinners. This may increase bleeding during your surgery. Weight loss before your surgery will help you with a better waist contour. Remember, lipo does not remove gut fat. For out-of-town patients, we'll ask them to arrive 2 to 3 days prior to your surgery. They should stay 5 to 7 days after the procedure. Will require a medical clearance. My preferred way of doing liposuction is under general anesthesia. The procedure will take between 2 to 3 hours depending on how many areas need to be liposucked. The day of surgery, we will identify and mark the areas of interest for liposuction. Usually they can be located anywhere in the body. Liposuction to the arms, the love handles, lateral thighs, and back usually have the biggest impact to your body shape when this procedure is performed by itself. Depending on the volume that is needed to be removed, a combined procedure with a skin excision is recommended for other areas such as the abdomen. We will place strategic access areas, which will allow us to inject numbing fluid and aspirate the excess fat, as shown here. This diagram shows the effect of fluid entering the area of liposuction. It will diffuse over the tissues. This process facilitates the separation of the fat as well as helping doing a more even removal of the excess fat tissue. The use of ultrasounds may help the emulsification of the fat, facilitating its extraction. Finally, we rely on the space to scar down and the skin to constrict and redrape to the new tissue space. Be aware that the more tissue that is removed, the less likely the skin will redrape evenly. Now let's talk about risks and complications. The purpose of this section is to inform you, not to scare you. The more that you know, the most likely the operation will succeed. I have always believed that knowledge is power to my patients. Let's start by recognizing that the more tissue that we need to remove, the most likely we will run into complications. However, I will be at your side the whole time to have you sailing through any problem we run into. Irregular contours is one of the main complications. Some of the causes are fluid accumulation between the tissues, fat necrosis, and scar tissue formation. Most frequently happens when the patient has excess skin or stretch marks. Saggy skin is like not downsizing clothes after losing weight, as shown by these two models. One has skinny jeans and the other one very loose jeans. The obvious consequence is less contour definition. It is more likely in patients that are older. Skin removal will be the solution if present. Seromas happens between 20 to 40% of the patients. It's the fluid collection between the lifted tissues. We will manage it with drains. Usually they are removed when they drain less than 30 cc a day, 3 days in a row. We will use also garments to try to compress the tissues against the deeper layers. We'll ask you to limit exercise, which increases the production of fluid. Skin discoloration is a must with this surgery. It is a consequence of bruising or accumulation of blood within the tissues, giving this black and blue coloring. It's also a consequence of skin burns at the entrance point of the surgery. Skin sensitivity may be present as itchiness, tenderness, or hot and cold sensitivity. Finally, some patients may react to the suture material. This will appear as persistent redness at the incision site. Some patients might form little abscesses. If present, we will need to remove the sutures and do dressing changes. Some other people might spit out the suture. If that is the case, we will trim out it in the office. Tissue swelling is the accumulation of fluid within the tissues secondary to a trauma. Expect a weight gain of 5 to 10 pounds. Usually it's worse within the first 2 weeks. It can last up to 6 months. You will notice that it's better in the morning and worse at the end of the day. You have to be patient. Bleeding occurs in less than 1% of the cases. It will appear as significant bruising and pain at the surgical area. If present, we will need to go back to the OR to evacuate the collected blood and to take care of the cause of the bleeding. There is a risk that we might need to transfuse some blood. It is very important that you do not use blood thinners that may favor this condition. Please review the list of prohibited medications included in your preoperative package. Infection may happen in less than 1% of the patients. We will use antibiotics before and after your surgery to try to prevent it. If present, we may need to go to the hospital for further IV antibiotics and potential surgery. In rare cases, there might be damage to the organs, including nerves, blood vessels, muscles, and internal organs. Deep venous thrombosis is the presence of clots in the legs that might travel to your lungs. The day of your consultation, I will be evaluating your risk factors for developing this condition. If your risk is high, we might need to give you a blood thinner to prevent this condition. Independently if you are at high or low risk, walking is your best friend after surgery. Please start walking the same day after your procedure. Finally, unsatisfactory result. Unfortunately, I cannot guarantee an outcome considering that I have no control over all the variables. Here you will find a list of all the complications that we have discussed so far in the presentation. I will do my best to avoid these potential complications. Most importantly, I will be always to your side, trying to correct any potential issues that may happen. Now, let's discuss some events around your surgery. 2 days before your surgery, we will encourage you to start preparation of your skin using an antibacterial soap called chlorhexidine. I will also encourage you to start a full liquid diet. This will decrease the bowel contents and it will favor the surgical outcome. The addition of milk of magnesia will help cleanse your intestine. Do it gently to prevent massive diarrhea. It is very important that you remain well hydrated. The day before your surgery, you need to stop eating or drinking after midnight. I will encourage you to take Tylenol 650 milligrams every 6 hours starting the day before your surgery. At the day of your surgery, at 4 o'clock in the morning, with a small sip of water, you're going to take your usual medications. You will also take Tylenol 650 milligrams pill. I will ask you to hold your diabetes medication. After surgery, the dressings that we'll use are an ACE wrap or a binder, depending on the area of the surgery. We'll encourage you to use garments within the first week after the surgery. We'll use drains if there is major mobilization of tissue, or if there is increased bleeding during your surgery. The usual duration of these drains is between 2 to 4 weeks. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as a working out pain or burning pain. The score is between 5 to 7 over 10. However, it is well controlled with the pain medications by mouth. We'll give you the specific regimen the day of your surgery. We will use multiple medications for the control of your pain. We'll use Tylenol at 9, at 3, at 9, and at 3. We'll use ibuprofen at 6, at 12, at 6, and at 12. We'll use oxycodone every 6 hours and Valium if we work with your muscles. After your surgery, you will have nausea secondary to the medications used for your anesthesia. We will encourage you to eat light food, and you can work your way up as you feel better. You will go home the same day after your surgery. We will encourage you to walk to prevent clots that can travel to the lungs. This is how you will follow up after your surgery. In the first week, you will have your first follow-up. Then you will be followed weekly until your drains are removed. A regular follow-up will happen at 6 weeks, 6 months, and a year. However, we'll encourage you to contact us if you have any questions at any time. Now let's discuss some frequent asked questions related to this procedure. The time of work is between 1 to 3 weeks, depending on your job description. You will feel 80% normal by 6 weeks. After your surgery, you are encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. You can shower 1 week after your surgery. However, you are encouraged to do sponge bathing until that. How to avoid infections. Do not use a cloth on your wounds. This might carry some bacteria that might affect your healing. We'll encourage you to use antibacterial gel soap as shown here. If you have drains, we'll encourage you to use peroxide to the entrance point of the drain to try to kill bacteria. Finally, when you dry up, use a dry, clean cloth to avoid contamination. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. Now let's review some patients that have undergone this procedure. This patient underwent liposuction of the trunk. She also underwent breast augmentation. Look at the definition of her abdomen 6 weeks after her surgery. This patient also underwent liposuction 360, abdomen and trunk. Look at the definition of her contours after 6 weeks of her procedure. This patient had a history of a breast lift and tummy tuck, but she wanted to improve the quality of her definition of the abdomen. This picture is 6 weeks after her liposuction. This patient underwent liposuction 360. Appreciate the definition of the six-pack muscle. This patient underwent a liposuction 360 of her abdomen and back with a BBL. This patient underwent liposuction to the back. This is another example of a liposuction to the back. This patient underwent Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. This patient underwent a Hight Definition Liposuction with a Brazilian butt lift. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.